Hey there, Hanover. This is Octavia Marsh, Executive Director of Hanover Cares. And today I have with me Fiorella Carhuaz. Fiorella.
Hi. Hi there. Yeah, I'm the public educator for the Virginia Poison Center.
Awesome. We're glad to have you on with us today. So for many of you, you know Hanover Cares, we have the Safe Homes Initiative. And our initiative is all about promoting, locking, and monitoring of alcohol and medications. So I'm excited today to talk with Fiorella a bit about medication safety and overdoses in teens from the view of the Virginia Poison Center. So Fiorella, tell us a little bit about what we're gonna talk through today.
Yeah, so I think it would be a good idea to just get us started with getting us familiar with who the Poison Center is, or who works at the Poison Center, and then we'll talk about medication overdoses in teens and the trends that we're seeing nationwide in poison centers, but also more specific to our area of Virginia.
Okay, that sounds great. So yeah, let's do it. So tell me a little bit who works at the Poison Center, what does the Poison Center do, and who do you serve?
Well, that's a great question. So a lot of people, when they hear Poison Center, poison control, they think it's just for little kids. And the reality is less than about half of the calls just for little kids. And then it's people from all ages, really. So we have at the Virginia Poison Center, we have trained nurses, so they specialize in toxicology. We have toxicologists on call, and then public educator, and that's me. And those nurses are just highly just trained in toxicology. They have to sit for an exam and everything, so they be able to provide the best information for when a caller finally calls, and the calls are free and confidential. We talk to the public, we talk to people from the hospital, EMS, just really anyone that is experiencing a poisoning.
Okay. And this service is completely free and confidential as well, correct?
Yes, a lot of people don't know that. I mean, you have this tool right there, just use the phone and call the 1-800-222-1222 number, and you'll be connected with this trained nurses. So Virginia Poison Center covers, there are 3 poison centers in Virginia. So we cover the Richmond area, we cover Tidewater, the Northern Neck, and South Side. And we keep very busy with over 38,000 calls about a year or so.
Wow.
Yeah.
That's a lot.
That is a lot. That is a lot.
Yeah. So tell me a little bit about how teens specifically, because that's who Hanover Cares has a focus on, is our teen population. And so how are teens being poisoned by medications, and what are some of the trends you're seeing from the Poison Center?
Yeah, so obviously we do get calls that are related to, let's say, street drugs as well, but not as many. So what we're seeing is a lot of calls related to medications, many of them over the counter. So how are they getting poisoned? So teens would either use medications to feel better faster, to get high, or any other reason. But what we will focus on would be what we call intentional suspected suicide. And this is something that we're seeing, and one of the biggest misconceptions and how it all starts is that, well, if it's prescribed by a doctor, then it must be safer than the street drugs. And this is something that we keep on seeing again and again. And this is an alarming trend. The suicide attempts in the pediatric population are rising at an alarming rate. And suicide is the second leading cause of death between 10 and 34. And we've seen more than one study that the majority are female. So we are seeing this kind of gender differentiation as well. There's something to worry about and see what we can do when it comes to public health and education.
Yeah, that's a great point. We talk about that a lot from the coalition's perspective with substance use disorders and mental health and how they're often co-occurring disorders. And now even some medications cause that psychoactive behavior. So I think that that's a great point, and glad that the Poison Center is addressing both and hopefully helping people understand that those things are relatable.
Yeah, and I mean, if I can mention, for example, there's a really big study that came out last October in 2019, and this is by Henry Spiller. So they analyzed the suicide attempt calls by self-poisoning from 2000 to 2018, and we had over 1.6 million calls nationwide for the younger crowd, so 10 to 25-year-olds. So that's a lot of numbers. I know this is nationwide, and again, in this big study, the majority are also female. They found really some other interesting things, like for example, there was a decrease in this type of calls for the ages of 10 to 18 during the summer. Which leads you to believe, I'm like, okay, those are non-school months. What's going on with that? And then the older the group, the more serious the medical outcomes is something that they also found.
That's great. And often even our coalition members, they ask, it's great to know the national data and what's being seen. So is there anything specific that may be unique or just, something that you all are focusing on from the Virginia Poison Center and what we're seeing here locally in our area?
Yeah, so as I mentioned, the Virginia Poison Center covers the Richmond area, Tidewater, Southside, and Northern Neck. And in 2018, we have over 3,000 calls for intentional suspected suicides. That's what we code them as when we use the poison control database. It's called Toxical. So, and we noticed that out of all those calls, 30% are for ages 10 to 19. So this is a big chunk. It is just 10 to 19 that's taking big part of on this call. So we need to do something about it and help and join other initiatives. And that's one of the reasons we joined you guys, the organization.
With that age group, are we typically seeing the parent call in for these calls, or is it like groups of kids?
No, I mean, that's a great question. Teens do call, but not as perhaps we would want them to. It's usually yes, the parent and sometimes another family member in the house, and we do have that. A lot of this calls start from home as well. And some of the things that we're seeing that they're taking for an area, and it kind of goes along with what's happening nationwide, is that they're taking analgesics, so your pain relievers, so things your acetaminophen, your ibuprofen, some more known as your Tylenol, your Advil. So there will be, for us, they're at the top of the list. And then antidepressants, antipsychotics that someone in the family is taking perhaps. And we have also a lot of calls, or we get a lot of calls on diphenhydramine, which is your allergy medications as well.
Wow. And these are things that really are probably in the average home. And so that even more and further supports our need for Hanover Cares and our coalition to emphasize the need to lock up medications. And we're not talking just painkillers, because you're talking just over the counter. So just things that people might not even consider that are essential to lock up. But anything can be harmful, whether it's used intentional or unintentional. So that's great. What about any specific cases that you might be able to share? I know sometimes people like having a visual or just, those jaw-dropping moments to just, know what's going on.
Yeah, I mean, well, we definitely got lots of those. And yeah, so for example, a very common call is maybe mom or dad walks in and into the teenager's room, and they found out that is just laying in the bed or perhaps even close to not being responsive. And they just find the person there next to perhaps pills, sometimes next to the bathroom, in the shower, and they could be unresponsive, and then they start looking for clues of what's around, to be able to tell what the teen has taken. So that's something that we, a pretty common call that we get is somebody walks into the room and finds a teen unresponsive. Other poison centers as well get different type of calls. So we obviously do get the accidental calls that happen in teenagers. So maybe they took a couple of tablets more for their ADHD medication instead of taking one tablet. That's what reading directions are very important. Perhaps taking prescription medications and combining them with over-the-counter medications for whatever reason. Again, this is something, there is a combination that of drugs that the teens are taking. For example, a 15-year-old was experiencing back pain, and he just took the parents' muscle relaxer, and the muscle relaxer was pretty, it was not out of reach. So then it makes sense that, oh, okay, well, I can go ahead and take it, and this is when they're taking it, and was not prescribed to them, so that could be a problem. Sometimes, yes, we do get those suicide attempts, and where a teen has perhaps taken a dozen or more prescription pills that belong to somebody else in the house. So it's usually, when it comes to medications, it really is what's available to them. So maybe the parent or grandparent or whoever is in the house, and especially we live in multi-generational homes. Many of people that do this, and it's totally okay. But what happens is that you are having different types of medications in the home, and again, many times they're not locked up. And what happens is that a teen has access to all of these medications, and combining them, it could be even worse.
Yeah, that sounds like such an important role that the Poison Center plays in this. And like you said, I mean, even I, for so long, just thought of the Poison Center as a place for, you call when your little baby does something or puts something in their mouth that they shouldn't. But I think that you all have a critical role in the community, and just thank you to everyone for all that you're doing, really in this effort to keep us all safe. So you talked through some things, and we might have some people watching that are thinking like, wow, I didn't know this resource was here. So talk me through how the process would be if one were to call the Poison Center. Like, what would happen? What questions might they get asked? Just to give people a level playing field in case they want to use this resource.
Yeah, so first of all, people need to know that when you call the Poison Center, the calls are confidential. So just like if you were to go to a doctor, your information is confidential. So we would usually get the name, the age, but most importantly, the weight as well, the substance that was taken, how much, how many pills, when is the approximate time of ingestion, and then other things is like where or why, and there's just kind of things that help paint a better picture of how bad the case is really, and then they slowly try to figure it out. So our trained nurse ends up being kind of like an investigator and trying to find out, okay, worst case scenario, and they do the math. But when it comes to if we already know this was an attempt for suicide, we usually recommend that they go seek care right away. And this is not necessarily is because they've taken something that put them their life at risk, but this is a protocol. Like if someone is attempting suicide, we go ahead and refer them to the ER right away.
Okay. So let's pivot a bit from that and talk a little bit, wrapping this up, just about prevention, because that's what Hanover Cares stands for. So let's talk a little how we can prevent, and anything or any tips that you recommend based on what you're seeing from the Poison Center.
Yeah, so I mean, the number one thing is to remove any expired, unused, old medications in the house that people are not using. So try to take advantage of drug take-back days, or sometimes I know, for example, in Hanover Cares, they also are able to help people and provide drug deactivation pouches, and other organizations. And we're doing this as well. So what we want is pretty much to get the drugs that are not being used out of the house. So that will be a big thing. So we talked about that, but also, a lot of people are taking medications. Make sure they are locked up and away from a kid. So sometimes people just say, oh, my kid is not going to take them. But, it's just best practice to always make sure medications are locked up and kind of keep an eye on your medications. I mean, same thing for over-the-counter medications, your ibuprofen, your acetaminophen. If you notice there are a lot less all of a sudden, someone is taking them, or they disappear. Something, again, we don't really think about, but it's definitely happening. I mean, we're getting those calls.
And I think gone is the old school thought of having the medicine cabinet in your bathroom, because I mean now, and especially with teens, when they go over to a friend's house and they're seeing the medicine cabinet, and even if it's just something simple like Tylenol, that's a risk that we're exposing our youth to. So that's a great point.
Yeah, and imagine if, they go to different houses, and then maybe they're also taking prescribed medications to them, and, maybe they get one for a friend as well. So this is something that, again, availability, we need to make sure that's not there, for teens. And just talk to your child about the dangers of medicine misuse, and a lot of people, again, they mention drug and alcohol, and it's obviously very important, but this is something that sometimes gets overlooked. Medication overdoses. Well, I would say just always have the poison control number as one of your contacts. So the calls are free and confidential. You're talking to a nurse that specializes in this. And just really, if you feel like you have some concerns about the mental wellness of your child, get in touch with your primary care provider. So what we do at the Poison Center is that we make sure your teen is healthy from more of a clinical perspective. So what needs to happen is, you need to have more follow-ups and things like that from the more mental wellness perspective. This is something outside of our realm, but that's what we team up with other organizations, and we recommend people look out and search for help.
Fiorella, you said two things that I wanted to just highlight, because you dropped so much good information there.
I know.
the magnets with the poison control number, we typically give them out with Hanover Cares whenever we're doing drug take-back events, or we're giving out the drug deactivation kits, or medication lock boxes even. And so definitely that's great to just have on the fridge. The hope is that you won't need it, but again, prevention is all about just knowing what resources are available if and when you do need them. And then the second part that I wanted to just emphasize, you talked about conversation, and that's another critical point that we emphasize in the coalition, just about having a conversation. Many of you may have seen our campaign, Just Say Something, and that's all about just being engaged as a parent, having those conversations, and just knowing what's happening in your home or even the homes that your kids may be visiting. So that's just super critical. So I'm going to pivot again as we just transition. We talk a lot in the coalition about things being hidden in plain sight, from objects to even behaviors. So what might be some behaviors or things to look out for in a teen that may actually help one identify a possible medication overdose?
Yeah, so maybe one of the things could be that withdrawal from family, of friends, even talks of suicide. This is something that a lot of people perhaps don't think, oh, that maybe they're just joking around or they want attention, but it's just something that we need to be aware. And if a person is talking that, oh, I'm looking into this, or maybe they're looking for ways, it's important that people pay attention to. And then things like abandonment of interest, all sorts of interest and hobbies. You also see the school grades dropping. Maybe the sleeping patterns are also changing. They're also a little more irritable, or perhaps they have some kind of hostility. So honestly, is any just that behavior change that you're noticing in a teen, and then you can kind of put things together, and we don't know if it's medications or prescribed medications or over-the-counter things, or street drugs, but that's what, if you've been fostering communication, it would hopefully help you to discern what's going on and what the problem is. But again, like you mentioned, communication is huge. And then from our end at Poison Center, we always recommend storage, proper storage, and looking up medications, and just kind of being aware of your surroundings and what you have at home. It can easily be taken by a teen or their friends.
Yeah. And I like to say too, like I always like to add in that disclaimer that even though we've talked through all these signs and symptoms of behaviors, they're not meant to be a diagnosis, especially now with school being out, your kids might sleep in. So that does not mean that there's an issue or something going on. It just means that there could be some cause for concern, or just something for you to be engaged as a parent and just have that conversation. So we like to just always say that. Not to scare anyone.
Absolutely. And there's more to that. And even things like the way we describe certain things and how to talk about suicide. I mean, for example, someone thinks oh, or do you want to hurt yourself? And in the teen's mind, it could hurting, no, for them is perhaps is another way out. And hurting, they don't see how that would be an issue for them. So a lot of people recommend is just being upfront and talking about suicide.
And that's a great thing too with our Hanover Cares resource card, which is also available digitally on our website. That resource, it includes not only substance use disorder resources, but also mental health, wellness, and other child and family resources. And so again, we just like to be the resource and to let you know what's out there and how to help you have these conversations. So
I think everyone should.
Yeah, everyone should definitely have that resource guide. They're all around the county, but again, they're on our website if you need to access that digitally. So Fiorella, lastly, how does one decide whether to call 911 or the Poison Control Center?
Well, that is a great question. I mean, we get this question quite a bit, actually. So for example, if someone has taken medication inappropriately, or perhaps you suspect a poisoning, if the person is unconscious, having a seizure, not being able to breathe, obviously you call 911. But if the person is conscious and perhaps they're even able to tell you what they've taken, you call poison control and at the 1-800-222-1222 number, and we'll be able to take it from there. And we follow all the cases until they're resolved. So let's say certain medication is going to take a long time for it to kick in. The poison control specialist would follow up with calls for as long as it takes until the case has been resolved and the person is back to being healthy. It's something a lot of people don't know.
Yeah. You're a wealth of information. I feel like we've learned so much about the Poison Center, and just thankful to have this resource right here in the Richmond area, and for us, for our coalition. So Fiorella, I just want to thank you for your time and sharing your wealth of knowledge with us. This has been wonderful, and look forward to continuing to work with the Virginia Poison Center.
Well, thank you, Octavia, and I mean, feel the same way. We'll continue to work together.
Awesome. Thank you.
Thank you.